want it to heal like this because so that's going to stretch them, right? When you stand up in the morning, first of all, you put your weight on it. Okay, so that's going to rip out what you just worked on healing. And that's why you have that excruciating pain in the morning. Okay, good supportive shoes. Old lady shoes like mine, my Birkenstocks. You will see me in as many Birkenstocks as you can. I learned that after some nice herniated disc. It's very, very helpful. And so pain control, ice pain control, stretching exercises help these people. Sometimes you can actually do cortisone injections for these people, and that might help that, or different surgeries on this musculoskeletal type. Plantar fasciitis, they don't usually do surgery for, unless it comes totally detached. Priority concerns with other muscular disorders. Contractures. Who's had little people, little old ladies, little people with contractures? Anybody? Anybody worked in a nursing home? Anybody seen anybody with contractures? You know what it is? Where they can no longer, even if you tried, you can't even move that arm. It's been so long that they've been maybe in a fetal position, or their hands, you can't get them open. If you can get them open, I'm going to pretend like we've got a washcloth and it's rolled up in a roll. And if you can get that, and you'll see them a lot of times, we will do this just to even keep from closing all the way. Anything you can do to provide a little movement in there. Because if you go ahead and you yank that, you're going to break it on these little people that are contracted. So you have to really worry about their wounds. Trying to remember whose patient it was yesterday. Little old man. He could move around, do pretty much whatever he wanted. He was real cute. But on the inner aspect of his knee, he had a sore. Whose was that yesterday? Anybody remember? What was yours? Okay. And what was his diagnosis? What was he there for? Abdominal pain / hernia. But here he had these little things on his skin. And I said, so what's that from? He goes, oh, I like to lay on my side. If I lay on my side, he goes, it's from rubbing it against the other leg. So his mobility was decreased. And look, here he was getting wounds. And this is a man that can get up and move and do what he wanted. But you could still see. And it was a good quarter-size wound on the inside of his knee. And I said, you need to make sure you put something in between there. You need a pillow between your legs if you're sleeping. Or you need at least like 3 layers of a blanket or a towel or something. But some of these little old people, it's not that important to them. Oh yeah, that's what that's from. So did he have some neuropathy? Could he not feel it? It didn't bother him, But it had been brought to his attention before, but he just didn't really care. Okay, pain. What are we going to give mostly for pain and musculoskeletal disorders? I'm sorry?
NSAIDs.
NSAIDs. Yep. All right. Yep, we talked about the stomach, so we don't want any GI issues or GI bleeding. Mobility. And, by the way, I talked about my GI bleed patient. Guess what he had the previous 2 days? NSAIDs brought along his GI bleed. Was there something there before? Probably, and that aggravated it, though. Okay, mobility impairment. So all these people with bone issues, they're going to have mobility problems, and we got to do our very best to get them fixed. Okay, and what we can do, whether it's other devices, is it a walker, is it crutches, what type of thing. Okay, what types of nursing care are common to any of these disorders? So as nursing, what are you going to think about for these patients? We gave you some of it.
Comfort.
Comfort.
Pain relief.
Pain relief. We're going to increase their mobility the best we can, or get them back to full functioning. What are we going to think? So they've got this, bone cancer now we talked about. We got to remember their psychological portion, how they're feeling about their disease process. And
Nutrition.
the other, nutrition is extremely important. All right, we talked about nutrition. What about their self-perception, and do they want to be seen by others? Do they want to be seen by others as disabled? Do they want to be seen with this huge foot? You know, do they want to be seen with problems that are obvious? No. So we got to keep that in mind. All right, we've got a nice case study. 64-year-old woman is seen in the adult outpatient clinic. She was measured as standing 65 inches tall last year. The nurse observes that the patient now measures 64 inches. She has a mild kyphosis. What assessment questions should the nurse ask at this time? You've got the answers at the bottom. What kind of things do you want to ask this patient? Does she feel like she's gotten shorter? Does she have any pain with lifting, bending, stooping? If the pain is worse with activity or relieved by rest. But the other thing is, what other things could we ask? We just talked about a little bit of it. To prevent it from getting worse, what can we make sure her intake is decent of? Calcium. What's she doing with her diet? And what's the other thing to prevent worse osteoporosis? Weight-bearing activity. So she could do some core work. She can do, if she wanted to do some yoga, if she wanted to just make sure she's getting her walking in, using that. But remember, we talked about the spine, so we have to increase your core to take, if you work on your core muscles, what does that do to the spine? It takes the additional weight off of it. So the spine's not working so hard to hold everything up. If these muscles are flaccid, the spine's doing all the work. But if these muscles are taut and better, then the spine doesn't have all that weight to support. The muscles are supporting part of it. Okay, the patient is diagnosed with possible osteoporosis. Which diagnostic tests would the nurse anticipate? Phosphorus, serum calcium, thyroid test, okay, to check for hyperthyroidism. And then we've got our DXA, the dual X-ray. And so what is that test checking for? We talked about it earlier today. Bone density and strength, bone strength. And they measure what three areas? Wrist, hip, and spine. Okay? And we said that we need to start that if we can in a female age 40. All right, case study. The patient is diagnosed with osteoporosis. Which intervention by the nurse would be appropriate? Most appropriate. That's what makes this one hard. Do we want her to cut down on her cigarette smoking? Yes. Do we want to recommend walking 30 minutes 3 to 5 times a week? Yes. Diet high in protein and calcium but low in vitamin D? No. Tell her to include high-impact activities such as running, mountain climbing, horseback riding? No. None of the above. Okay, so our best answer is that exercise portion. And the problem with the calcium is that they said low in vitamin D. That's what's wrong with that answer. So here's one where smoking, A is a correct answer, and B is a correct answer, but which one is the most important at this aspect is the exercise. And that'll be the majority of the patients, hopefully, anyway. I think a lot of our people are smoking less, hopefully. Next case study. Which patient's statement about self-care indicates a need for further teaching by the nurse? I like this one a lot. What's wrong with joining the bowling team? Not really anything wrong with joining it, but to think that that's your exercise. Because that's not going to be a weight bearing. I mean, you are going to hold a bowling ball for a little bit, but that's not going to be long enough, okay? So, do we want them to swim? Yes. Low-fat yogurt, perfect, because that's good calcium and low-fat diet. And my husband's getting rid of our throw rugs. Any comment?
I said that's good. So they won't fall.
I'm telling you, there's so many people that come in because of throw rugs. That was one of the first things I did when my dad died. He didn't die of throw rugs, but I just knew my mom had had a club foot and her stability was not that great. And she had already had falls. So Chief, my dad, we called him Chief, had to have the throw rugs down because you couldn't get the carpet bad. Couldn't make the carpet look old. So he had throw rugs on top of carpet. Okay. All down the hallways and that. And so one of the first things I did when my dad was kind of like, okay, time for these to go, Mom. We don't need you falling. You're living on your own, you know. She was like, okay. She didn't complain about it. All right. The provider orders calcium 1.5 grams orally twice a day, 1 gram in the morning and 500 at bedtime. The patient asks why she must drink extra fluids with this medication. What's our best response? Prevents kidney stones. Exactly. Because calcium will cause those kidney stones, but we want to make sure we get calcium in where she needs it. But if we have enough fluid with it, then we won't end up with kidney stones. Okay, she also asked why she can't take it once a day. And what's most important? It should be taken at bedtime. The third dose is most readily utilized by the body when the patient is fasting and immobile. And that body is resting and healing. Besides just calcium like that, what's an easy fix for women to get their calcium in? Something over the counter that we can take easily, especially if you're taking it at night with your nighttime medications. Tums. Tums are an excellent source of calcium. Will not harm you to take 2 Tums at night. Okay? But that's one of the quickest and easiest ways. You know, I think God designed it. Think about these pregnant women and they have all this indigestion. And, you know, I remember I lived with Tums in my pocket and I won't forget why, because I went back after having that first baby to work. I was doing cardiac rehab in the gym and I put on my jacket and what did I have? A bottle of Tums still in my pocket. But I went, oh, thank God I don't need these anymore. But yes, because that baby it's going to take a lot of that calcium out of your own body, so it's making sure you get it replaced. All right. Community education program. The nurses asked about the risk of a woman breaking a bone due to osteoporosis after age 50. The nurse knows which of the following is the risk. 1 in 2 women, 1 in 5 women, 1 in 7, 1 in 10. Who wants to read that answer? Pretty nice, huh? 1 in 2 women over the age of 50 will break a bone because of osteoporosis. A woman's risk of breaking a hip due to osteoporosis is equal to her risk of breast, ovarian, and uterine cancer combined. Women have lighter, thinner bones than men. Many women also lose bone quickly after menopause. And what's that bottom part saying? Because I can't read that. Up to 1. Let's see.
1 in 4 men over the age of 50.
Men over the age of 50, and especially in the 7th and 8th decades. Yep. What did we say about a hip fracture? Increased mortality in the 6 to 12 months.
Is that due to bleeding or just the...
Hip fracture is usually the immobility. It's not usually bleeding, it's the immobility for that patient. And it changes their lifestyle around, so it could be the VTE, the venous thrombose, embolectomy. We'll have that blood clot. Which assessment data would the nurse expect in a patient diagnosed with osteomalacia? Lack of vitamin D, decreased bone mass, lack of estrogen, elevated blood sugar. Osteomalacia is the loss of bone related to the lack of vitamin D, which causes bone softening. We definitely need a vitamin D. We talked about that. This normal bone is disrupted. The complication does not occur to harden the bone. So we would expect to have lack of vitamin D and a decreased bone mass because there's less bone. But A is the main thing that we're looking for, nursing wise. Okay, patient was just diagnosed with Dupuytren's contracture. Which statement by the nurse is most common? It will improve with time. The cause of this condition is aging. Fourth and fifth fingers are most often affected. And this condition is never bilateral in nature. We know it can be bilateral, right? And which one do we know it's, which fingers? Fourth and fifth fingers. Who did we say this was most common in? Euro-Asian, or Euro-American men. Okay? And it could be hereditary too. And what would we do to fix this one? Surgical release. And that is the end of those. Questions on this portion? By 11:40, you said? So that means, any word on pizza? If you would, please, that would be great. Thank you, thank you. It was supposed to be delivered at 11:15. I have a witness for what I ordered it for. Let's see. I think that's all I have on this portion. And we were about time. So, any questions on our previous one? On our previous chapter of the musculoskeletal system. Osteoblasts are the bone-forming. Blast, think of the B with the bone-forming cells. And the clasts are which one? They destroy the cells. So you'll see that a lot. Go ahead. Somebody said something? Okay. Excessive alcohol intake can decrease vitamins and nutrients. We'll go over that. Okay, we'll talk a lot later today about the synovial joints. Those are membranes with fluid lubrication. Versa. Trying to think if there's anything else. What kind of spine thing do we think would be wrong on a 15-year-old? There you go. What do we talk about? Something a long-distance runner could get in the arch of the foot? Problem with getting out of bed? Plantar fasciitis? One of the things that my son was telling me about the surgeries, typically we have somebody come up and they have, if they have an extremity surgery, what do we think of as far as, especially if they have one on their foot, what kind of things do we think we want to do for that patient to decrease swelling?
Keep it elevated.
Keep it elevated. And he said, Mom, there's been a change. And I said, what's that? He goes, if they are a smoker or their tobacco use, he goes, we don't always want to elevate it. He said, because it's more important that we have blood flow to heal that tissue He said, so in the smokers, we will not elevate an extremity. And I was like, I had never thought about that. That was definitely something new. He said, yeah, they have proven that one. I'm like, okay. So as far as we're looking at our patients and our care afterwards. Let's see here. Wonder what this one is. All right. You give half attention to this, we'll be good, I think. Back training and transfer training is very important. You can never protect your back too much. So let's go ahead and see. And it won't download, or is there something I'm doing wrong? I'm doing incorrect? What's that? Oh, I thought you were, sorry.
It's probably just poor internet.
I think it's poor internet. Anybody have questions on the dual care map? You want to see one of these? Anybody have questions on the dual care map that are due next week? This week we did the single ones. For clinical? I think it is internet. I think you're totally right.
Well, you can press the arrow thing.
This one? Thanks. See? You can all help me with that. It's all right to laugh at me. My kids do all the time. Like, oh my God, no. I'm like, are you kidding? There wasn't even computers when I was in high school. I'm that old. Yeah.
Is this for both clinicals?
Both clinical
Due next
notes.
week.
Due next week.
Can we draw them?
It's a little more advanced.
Yeah, but. Okay.
What's that?
I was just asking, like, if it doesn't fit on a Word document, can we draw it?
You can draw it. I am good with that. I don't think Becky will have any problems with that. And I kind of like the drawings because then you can use your colored pencils and things and you can color code them. And I think that's helpful.
There's supposed to be the same intervention for both diagnoses.
It doesn't have to be the same intervention.
Okay.
It could be, but depending on like this one. So this is a 90-year-old female. Okay. What did she have? Multiple fractures. Can you imagine that? So nursing diagnosis 1. Acute pain related to multiple fractures, as evidenced by pain score 7 to 8 on a 10 scale. Okay, so what are we going to do for her as we go down the left-hand side? We're going to teach her the importance of letting us know she has pain, assess her pain, and administer pain medication to get her to move, right? She needs to know to report the pain. We have to remember some of these people don't remember to report their pain, or they forget to do that. And so sometimes if a patient's not telling you they have pain, but they're like this, their forehead's like this, or they're grimacing, or they're grinding their teeth, you have to look for, or they're clenching things, they may be in pain and they may not be asking for something. Okay, let's see. So that was one. If you look at this middle bottom, you're going to see that these interventions, they match up, but they will also match what we're going to do our care for the second diagnosis. Because we're going to take deeper breaths, which will help her pain, up to ambulate 30 minutes after the pain medication is administered, and reposition after the pain. All those things are going to help with that ineffective airway clearance. You see what I mean? So we have a set specifically for her pain. We have a set over here for the ineffective airway clearance. Take your deep breaths, cough PRN, use that ascending spirometer. How often do we need to have them use that? 10 times an hour. It's one of the most important nursing interventions you can do. Administer decongestant or expectorant for the orders, clear the secretions, but as we go through all these, everything with the ambulation and keeping their pain down so they can breathe deep and do their incentive spirometer, see how it works for both. And they're totally unrelated as far as pain versus airway clearance, but yet they are, because the things you're doing work for both. All right, then we're going to have our outcomes at the top, and did we meet them? Because we went through the evaluation. They were able to cough and deep breathe. They were able to tell us when they needed pain medication. We were able to give them pain medication. And it doesn't always have to be met. This bottom one in the middle, they didn't meet the repositioning. Patient might not have, they might have refused. Or another unmet, patient not using the IS as often. And another unmet that we can't help is for the orders, the decongestant and expectorant. Okay? Do you guys care if I call Papa John's, especially if they're not here yet?
Just keep downstairs.